Obviously, we take very seriously this issue of the coronavirus. Our health minister is engaged with her partners at the provincial level, and we're working with international partners as well to ensure that we have the best response possible. We're, of course, looking at any extra measures that need to be taken to keep Canadians safe and to prevent the spread of this virus.
For Canadians who lived through the deadly SARS outbreak of 2002 and 2003, recent headlines certainly feel a bit familiar. More than 600 coronavirus infections and a death toll that now sits at 18. The virus originated in China, but has since arrived in other countries, including the United States. Today, members of the World Health Organization met for a second time in as many days to discuss the coronavirus, and ultimately, they determined there's no reason for the world to panic, at least not yet.
This is, though, an emergency in China, but it has not yet become a global health emergency. It may yet become one.
To contain the virus, China has locked down 3 cities containing a total of 18 million people. Here at home, there have been no confirmed coronavirus cases, but at least 5 people are under observation over concerns they may have been exposed. If the virus does reach Canada, are we prepared? What did we learn from SARS? Anne McClellan served as federal health minister during the SARS outbreak. She's now a senior advisor with Bennett Jones and joins us from Edmonton. Hi, Ms. McClellan. Nice to see you. Thanks for making time.
It's my pleasure.
Let me start off with the World Health Organization. Its emergency committee said today, as we just reported, that it's too early, really, to declare this an outbreak or a public health emergency. However, the committee did say that they're split 50-50 on that decision. Should we read anything into that?
I think simply that there are differences of opinion as to maybe how much information and how accurate and up-to-date and timely the information is that they are getting from their contacts on the ground. And I think also a fear, probably especially with Lunar New Year coming up, that even though they have I think, done a remarkable job of containing the spread of this virus so far, it's going to be awfully hard over the coming days with so many people on the move. And yes, they've shut down Wuhan and a couple of other metropolitan areas in China. But the population is so vast, so many people move during Lunar New Year. I think the World Health Organization will be monitoring this hour by hour and day by day. And therefore, the president of the WHO was right to say that it's an emergency in China. It is not a global emergency at this point because the Chinese have actually done a good job of containment so far, and they will watch and see. But you know what? Reasonable people of good faith can disagree in terms of what they think they're seeing in relation to evidence and whether they think they're getting the evidence they need to make a reasonable decision.
I want to ask you specifically about China because obviously they have taken a number of measures to contain it, including essentially quarantining an entire city. Part of the problem during the SARS outbreak, or what was later revealed, was that there was a lot of underreporting that happened in China, and China's actions were very much criticized. And I'm wondering, how much faith we should put in their actions now, not necessarily the containment side of things, but the reporting side of things, and if there should be cause for concern.
I think the Chinese learned, as we all did, a very valuable lesson from SARS. SARS was ground zero, not only for us in Canada in rebuilding our public health system, but it was ground zero for the world and the WHO. And the Chinese learned a very valuable and a very costly lesson there in terms of not sharing information in a timely fashion, not having direct contact minute by minute where necessary with WHO officials, with their colleagues, even our scientists here in Canada. We have some of the best epidemiologists in the world, and we were on the front lines of the science of SARS. And I think what the Chinese learned was that there's no point in hiding anything here. We live in a global world. The costs are too great, human and financial. And my sense is, based on everything I'm seeing, that the Chinese learned the same lesson we all did, and that the WHO must be convinced that they are getting timely, reasonable information. Otherwise, they would not have postponed declaring a global emergency.
What about the Canadian response? And I guess, given your experience in this role, what the federal government should be doing? Obviously, there's a huge amount of expertise in this country that is far beyond my basic understanding of this. But I think there's a lot of people who remember going through SARS and who remember, and to be fair, your government and even you sometimes individually were criticized for not taking enough precautions soon enough.
Absolutely.
And I'm wondering, based on your experience, what your advice to this government would be, apart from, and I like I said, there's a lot of scientific expertise out there, but from a matter of, from the perspective of how people perceive this and how worried people can get, and that they want to feel like every precaution possible is being taken, based on what you went through, what would your advice be?
I think you have to stay on top of it. I was pleased to see the Prime Minister address it today coming out of caucus. I'm pleased to see the Minister of Health giving updates in relation to what she is seeing and hearing from her public health officials, and they are being fed information from provincial public health officials and from certainly major urban centers like Vancouver, Edmonton, Toronto, and so on. I think with SARS, I will say this, I take full responsibility for this. I've thought about this a lot over the years. I should have communicated a lot earlier with the Canadian public. I thought it would be better if the Canadian public heard from my scientists who understood the virus and could talk to Canadians about all those kinds of things with authority. And actually what they wanted to hear was from me and from the Prime Minister, but from me as Minister of Health. And I should have been out there a lot earlier and talking to Canadians, helping Canadians understand what we knew, what we didn't know. You never want to create panic, but you want to be honest with Canadians. It's this balance, Vashi, as it always is. You don't want to overreact, but you don't want to underreact. And I would say communication is important here from the highest elected official levels, but communication from experts in the field, absolutely. And what we didn't have, as I say, we rebuilt this system after SARS. And let me give a big call out to David Naylor, and who headed up our lessons learned exercise, and his team, because basically public health has been rebuilt in this country on the basis of the recommendations David Naylor and his team made. Hence, we have a public health agency. We have a chief public health officer for Canada. We completely redid the Quarantine Act to clear up all those issues around, can we hold someone at an airport? What are our powers around screening? What are the privacy issues here? All of that has been dealt with in light of the Naylor report and the SARS outbreak. So what you need here is close collaboration, coordination among the three levels of government. You've got city, chief public health officers. You've got provincial and federal. They need to talk. They need to cooperate. There should be no jurisdictional squabbles here. Information about individual patients has to be shared quickly and appropriately, obviously, but quickly, so that we can keep a handle on what is happening on the ground. And let me just say, one thing I learned from SARS, we have some of the most dedicated frontline healthcare professionals you will find anywhere in the world. Those people risked their lives, and in 2 cases, nurses died, to save so many people in and around the city of Toronto. And it's about training. We stopped training, Vashi, public health experts. Medical schools decided it wasn't a particularly glamorous part of the curriculum. And we, over these past 16 years, all of a sudden people realize public health is at the coalface of the safety of our people. And therefore, we have rebuilt those resources. Are they enough? I've been away from this for a while, so I can't say. I think probably there's always a case for additional resources, human and financial. But we have come a long way, and it's about communication. It is about collaboration, and it is about making sure you're collecting the data, analyzing it in real time, and getting it back to the people who risk their lives every day to keep us safe.
Okay, I'm going to leave it there. Ms. McClellan, pleasure to have you on. Thank you very much.
Thanks so much.
Anne McClellan, former federal health minister. The World Health Organization has decided not to declare the coronavirus outbreak in China a global health emergency, despite the ongoing spread and fears of the disease.
Make no mistake, this is, though, an emergency in China. But it has not yet become a global health emergency. It may yet become one.
The WHO did say its emergency panel was split on whether to declare an international health emergency and may reconsider it in the coming days. China's unprecedented measures to contain the virus factored into the WHO's decision. At least 3 cities near the outbreak's epicenter have been locked down. Today, China said 18 residents have died from the coronavirus and more than 630 people have been infected. Confirmed cases have also been reported in 6 Asian countries and 1 case in the U.S. Here in Canada, a team of researchers is aiming to develop a vaccine for this strain of coronavirus. Dr. Volker Gertz serves as the director of the University of Saskatchewan's Vaccine and Infectious Disease Organization, the International Vaccine Centre. He joins us from Saskatoon. Hi, Dr. Gertz. Great to see you.
Hello. Thanks for having me.
Can I kind of start at the beginning with you? Could you, in layman's terms, just explain what this virus is exactly?
Yeah, so this is a coronavirus. It belongs to a family of viruses, which we call coronaviruses. They're commonly found in animals and humans. You can have respiratory coronavirus, enteric coronavirus. So there's a whole group of these viruses, and this one is a new mutant that recently emerged, as you know, and it's now affecting the lung, and so it's a respiratory coronavirus.
And so how does it present in people?
Well, so this one is actually not as severe as SARS is. So it presents with high fever, some respiratory symptoms, cough, malaise, and so on. So, you know, what you commonly would describe as a common cold.
So does that make it difficult to sort of know that you have it?
Yes, so that's part of the problem, and so this is, you know, where the public health system is monitoring right now. But you know, you can imagine provides a big challenge to distinguish between the flu and the coronavirus. So this is where new tests are coming in, and unfortunately, those are available now, so you can quickly diagnose this.
And what about the discussion surrounding whether or not, how it's transmitted, rather? So this phrase human to human versus through animals, like what is the significance of how the disease is transmitted?
Yeah, so it's very important. These coronaviruses often jump species barriers. So they come from animals, they go into humans, and then that's where they cause problems. And sometimes it happens the opposite way. So they even go into animals and cause disease there. The significance of this one, the Wuhan coronavirus right now, is that everybody is monitoring right now how it behaves in humans. And so the WHO declaration that came out, or the decision not to call it a global emergency, is really based on that. We don't see, at the moment at least, human-to-human transmission outside of China.
And does that mean that if that were to change, and I'm guessing that's the thing that they're mainly monitoring, if that were to change, then a reevaluation obviously would be necessary?
That's correct, and I think that was clearly stated even in your clip that you showed there. That's what everybody's watching now, what will happen over the next few days.
Okay, and let me ask you, because I understand that your lab at the University of Saskatchewan is looking to create a vaccine for this strain of the coronavirus. How would that work?
So I'm the director of Video Intervac. Like you said, we're one of the largest infrastructures in the country specialized on infectious diseases. And we have what is called a high containment lab, the International Vaccine Center. So we are equipped to work with these diseases. We're equipped with what is called level 3 pathogens. And so the new Wuhan coronavirus is such a pathogen. So we can work with the virus now. And so we launched a vaccine project in collaboration with a public health agency. We're looking now to quickly generate vaccine candidates and then test them in animal models, the ferret, and see if they work.
And how is that, I mean, for someone that, like myself, who doesn't understand how the process works for a vaccine to actually become widely available, what does this process look like?
So the first few weeks is really to generate a vaccine candidate. We hope that we can do the work in maybe 6 to 8 weeks. The next phase then is to go into animal models, and there you show proof of concept. So you immunize these animals, and then you infect them with the virus, and you show that the vaccine protects them. Once you have proof of concept, there is a development phase, so you now have to find ways of how to manufacture the vaccine, to demonstrate its safety, and then also show that in clinical trials it's safe and works. And then it could be manufactured and released.
And how long does a process like that usually take? I imagine it's different depending, but how long?
Yeah, so that's of course the question that everybody's asking. Typically, the development of a vaccine can take many years. In urgent situations like that, there is ways to fast track it. But realistically, I think it's reasonable to say that it couldn't be done faster than a year or two.
And what is your sense of the, I mean, obviously we're reporting on it quite a bit. We know what the WHO said today. What is your sense, I guess, of the risk that this poses right now globally?
Well, I think, like I said, it depends on how the virus behaves over the next few days, what we're seeing there. If we don't see that the virus settles in the human population, meaning that there is not much more human-to-human transmission occurring, then I think this might be a more global problem. We don't have to worry too much about other countries being affected as well. It could change that. The virus can mutate or change its behavior, and if there's changes in the transmission behavior, then it really, it's just a matter of time before it gets to other countries as well and causes some larger outbreaks there.
Okay, I'll leave it there. Thank you so much, Dr. Gertz. Appreciate your insights this evening.
Thanks for having me.
Dr. Volker Gertz of the University of Saskatchewan. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.